As with other forms of osteoarthritis, OA of the hip or knee is a progressive disease of the whole joint that leads to breakdown of joint cartilage and the underlying bone and has a detrimental effect on the joint lining, surrounding ligaments and muscles. OA occurs when the body is unable to keep pace with repair of deteriorating cartilage tissue. Cartilage is a firm, slippery, compressible material that covers the ends where two bones meet to form a joint. It reduces friction between bones and acts as a shock absorber. With abnormal loading, injury, or inflammation, the cartilage of a joint can become thin, cracked, and frayed, which can in turn lead to pain, inflammation, and stiffness. Osteoarthritis is usually a slow process that occurs gradually over many years. It may be difficult to diagnose osteoarthritis of the hip initially because the pain can occur in other locations such as the buttock, groin, thigh, or knee. With knee arthritis, where you feel pain in the joint may vary and can even extend to the front of your leg. Your experience may range from a dull, throbbing ache to a sharp and stabbing pain. It's not known what causes OA of the hip and knee, though several factors can contribute, including joint injury, lack of activity, poor muscle strength, increasing age, and excess weight. It may also be a result of improperly formed joints, genetic or inherited weakness of the cartilage, or from extra stress on the joints. For people with OA of the knee or hip, muscles that move the joint can gradually weaken, making your everyday activities like walking and climbing stairs more difficult. You may feel that you can't trust your leg as it gives away due to weakness or pain when you put weight on it. As a result, people with OA of the hip or knee may become less active, leading to physical deconditioning and loss of strength, which in turn contributes to the progression of OA. This downward spiral can also result in low mood and fatigue. Fortunately, regular exercise and physical activity can help maintain and increase strength, endurance, and range of motion. An exercise program that targets the specific muscle groups and areas affected by OA can help reduce pain and disability. A program for hip and knee OA should include aerobic or cardiovascular exercise, muscle strength, neuromuscular strength, and flexibility exercises. For more information about the different types of exercise and physical activity, watch our video, An Introduction to Osteoarthritis and Exercise, available on the Arthritis Society website at arthritis.ca. If your arthritis pain is worse on stairs or with longer walks, consider starting with activities that put less weight or load on your joints, such as cycling, walking with walking poles, Tai Chi, yoga, Pilates, and water-based activities like aquafit, swimming, or pool walking. For more information about low-load activities, how to set them up, and how to modify, visit the Arthritis Society website for our resources on low-load activities for osteoarthritis. You can also learn more about activities that may increase your pain and how to modify them in our resource Modifying Activities for Osteoarthritis. These resources are available on our website at arthritis.ca. When working on cardiovascular, strength, or neuromuscular activity to increase your stamina, get stronger, or improve your functional movement patterns, you need to consider 5 exercise principles. These principles will be used in the exercise program and progressions that follow. The first principle is adaptation. Our bodies get more fit by adapting to stress. Increasing fitness involves progressive cycles of increasing stress or load to which the body adapts. The exercise shouldn't feel harder and harder to do, but instead you'll notice what used to be difficult now becomes easier. The process of adaptation results in your body having a greater capacity to manage stress. The second and third principles of overload and progression are ways to gradually get your body to adapt to a higher level of fitness. The second principle is overload. For example, to strengthen your muscles, you would use a gradually heavier weight or a stiffer resistance band. For cardiovascular exercise, you may put in a slightly higher effort for short periods. The third principle is progression. For cardiovascular exercise, this could mean gradually extending the length of your workouts over time. For muscle strengthening, it might be gradually increasing the number of repetitions or sets of an exercise that you perform. For neuromuscular training, it may be keeping good alignment and movement patterns in different and more difficult positions. The fourth principle is that of specificity. In other words, the way you do exercise has to be similar to the activity you're trying to improve. For example, during most of the activities of our daily lives, our feet are in contact with the ground or a solid surface that provides resistance. This is called closed kinetic chain exercise. You eventually want to be exercising in this manner to load your muscles and joints in the way you do in everyday life. Open kinetic chain exercises occur when your hand or foot can move freely, not pressing against something else. You might start with non-weight-bearing exercises, for example, laying down or sitting, that work on a single muscle group. However, you eventually want to progress to weight-bearing exercises, for example, standing, and exercises that involve multiple muscles and joints, also known as functional or compound exercises. The fifth principle is that of regression, better known as use it or lose it. All the gains you've achieved by exercising are gradually lost when you stop. It's important to keep these principles in mind when you're starting a new exercise routine or looking to increase your physical activity to help address osteoarthritis symptoms or improve your physical fitness. If you're new to exercise, it's important to first speak with a healthcare professional to make sure that you're fit to start a program.